I went to a traditional medical doctor for a physical. It just been a long time, so I decided to do one, and he did kind of a blood panel and found that my thyroid was low and that he wanted to check on it. And I'm not really sure how long it was, just because I didn't really know anything was wrong until they did a blood sample. But I would say that I probably was having fatigue and stuff for at least a couple of years. I noticed a significant change just by changing my diet and my energy levels and eating healthier and keeping my blood sugar stable throughout the day. And as I thought about that, I was like, why would I pay a little bit more for this car that's obviously not going to last forever to run smoother and not treat my body the same way? Because I only get one body in my entire life, right?
Hi friends, Dr. Loren Grover here, and I'm sitting down with Lindsay, who's been willing to share her experience of working with me and working on her thyroid and gut health. And I think her experience will encourage a lot of people. So let's get started. First up, Lindsay, go ahead and just introduce yourself. Tell us a little bit about yourself, and then we'll jump into your experience.
Hey, my name's Lindsay, and I'm a mom of 4 and married to my husband, Steven. And I love to do anything outdoors, cooking, baking, camping, hiking, anything outdoors. And we love playing games too.
Sounds like a lot of fun over there. I like it.
Yeah, it is.
All right. So, starting out, just, thank you for being here. And I want to have you share what you were dealing with before we began working together, like anything as far as what symptoms were showing up and what made you start looking for help.
So I went to a traditional medical doctor for a physical. It just been a long time, so I decided to do one, and he did kind of a blood panel and found that my thyroid was low and that he wanted to check on it. And I knew that you worked with people that had thyroid problems, so reached out, and my thyroid levels have gotten a lot better just with all the diet changes I've made and supplementation we've done. I just felt like that was really encouraging because I wanted to approach it from a more healthy standpoint rather than just taking a medication to either cover up symptoms or treat symptoms. I wanted to try to get to the root cause of what was causing low thyroid. And so I just liked that approach.
Awesome.
And it's been very helpful.
How long had you been dealing with those issues before you came in?
So I'm not really sure how long it was, just because I didn't really know anything was wrong until they did a blood sample. But I would say that I probably was having fatigue and stuff for at least a couple of years. I noticed a significant change just by changing my diet and my energy levels and eating healthier and keeping my blood sugar stable throughout the day. So I feel like I wasn't super aware until I kind of reflected back, just kind of dealing with it, right?
Makes sense. Yeah, it's one of those things that you can't tell, like the small shifts that got you to where you're at, but looking back, it's a lot more obvious.
Yeah, for sure.
All right. And then before starting the program, what had you tried, or were you mostly just going to that doctor that you mentioned?
Yeah, I had just gone to him briefly. Hadn't really tried anything before, but I've just always tried to approach things from a nutritional and really health standpoint. I would love to avoid medication wherever I can.
Awesome.
Yeah, that was great to just know that this was a resource and an option, and it's been just really helpful and beneficial.
And then once we got started with the supplements and the anti-inflammatory diet, what were some of the first changes that you'd noticed?
For sure, energy levels, like I mentioned before, less of the afternoon, kind of hitting a wall and wanting to reach for the sugar. Also, I just noticed a really lightness in my gut. I just remember feeling like there wasn't this heaviness that I hadn't, I don't think I even realized it was there before until I was like, oh, this feels so good.
It's like a breath of fresh air, but for your gut.
Yeah, for real. It just felt really free and open and just kind of light. And don't know, I just really enjoyed that.
Was there anything that surprised you as far as the results that we got?
I think it was just shocking to see like the food that I was taking and the supplements that I added just like drastically changed the labs I had, because we did a couple different blood draws, and I was like, wow, this is like working and changing things, and like I was feeling good. And so like that was just super awesome to know that I can make a difference. My choices matter. It gives you
some like sense of power or control over your life, right? So you're not feeling helpless or out of control.
Yeah, true. Yeah, I think maybe like a year ago, maybe a little more than that, before I started working with you, I remember attending a gathering and they had those drumstick ice cream bars. And I was like reading the label and like, wow, there's a lot of stuff in here. A lot of calories, a lot of things I can't pronounce. And at the same time, I remember it was during the summer and gas prices were really high. And our car in the owner's manual, it had told us to put in the premium gas. And the gas prices were just so crazy that I'm sitting there at the gas station deciding, do I want to put the expensive gas in or the cheaper gas? And I just know that my husband prefers the more expensive gas because the engine's going to run clean. It's going to help our car last longer. And as I thought about that, I was like, why would I pay a little bit more for this car that's obviously not going to last forever to run smoother and not treat my body the same way? Because I only get one body in my entire life, right? And putting like that drumstick in my body is like just putting things in the engine of a car that are going to clog it up and not help it run as smooth. And I feel like that was like a pretty cool epiphany to have. And as I went through the anti-inflammatory diet and actually saw and felt those changes of taking out processed foods out of my diet and eating every couple hours to manage my blood sugar, like I felt like that engine that was like running better. And so I just felt like that was just like a really neat thing to realize and to just know that, yeah, this is my one body. I need to take care of it. And when I do, I feel awesome.
Wow. So, I love that. I like your sense of responsibility for your health. And that's a beautiful analogy.
Yeah, it's been cool. I really kept that with me and in the forefront of my mind as I make food choices. And granted, I'm not always perfect, but I feel like it helps overall. And then things are just better.
Awesome. So let's talk about the progress that you made. You said on your intake, you rated your energy as a 7, but now you rate it as a 10. So how does that feel in your daily life?
Yeah, I feel like I don't know, like I said before, I felt like in the afternoons, I'd like hit that wall where I'm like raiding the pantry looking for chocolate or treats or something. And I honestly, after eating this way and for doing it for an extended period of time, I feel like I don't really have that craving or that urge, that sensation. I don't hit that wall in the afternoon anymore. And it just feels good. I can get the things done that I need to.
Awesome. So. You'd also mentioned that you had improvements in digestion and weight and mood. Can you describe what that's been like?
Yeah, I just feel like that lightness I described, like, I don't know, things must have been kind of clogged up inside and just not flowing smoothly and regularly. And it just really cleared that out and feels like it's running smooth and normal like it should. I feel like hitting that wall in the afternoon definitely would affect my mood kind of for the remainder of the day, which is the time of day kids are getting home from school and we got the runaround and dinner to make and homework to help people with. And it just is really helpful to not really feel that, I don't know, that crash.
Yeah. Excellent. I love that though. Like you had said, you have peace in your gut. So that's a nice visual as well. So what would you say has been the biggest shift for you mentally or physically through this process?
I didn't really mention this before, but like We had played with some different supplements around my menstrual cycle, and I've noticed we started a supplement at one point for a week before my period would start, because that's when I would notice my mood change and also just start not feeling great. Been able to tweak that to just take it 3 days before, and then I don't have like crazy cramping. I feel like myself when I'm on my period.
That's awesome.
And that's been like pretty monumental, I feel like, because that happens every month. And sometimes it just takes a toll to have to like go through the dip and then come back up. And I just feel like I've been able to stay more level and still accomplish things, still do things, still enjoy life and not have to be suffering with that. So that, and then just the overall feeling of energy and well-being, just that lightness in my gut and just the peace that it brings to just feel good.
Yeah, that's awesome. Thanks for sharing that. So for someone watching who is struggling with thyroid issues or gut symptoms and just wondering if this kind of program could help them, what would you tell them?
I would say it absolutely can. It's definitely worth giving a shot to. Like, I saw huge changes and I just feel like it really makes a difference. It makes a difference to learn about how your body works and what it needs to fuel itself and to feel good and how to take care of yourself. And sometimes, I don't know, I just feel like life gets busy and things get in the way of us taking care of ourselves. And this is like a simple approach to be able to feel good. And honestly, I feel like it's really sustaining and manageable to keep up with, and it makes a huge difference. It will change your life and bless your life.
Awesome.
It's done that for me.
Yeah, I was going to ask how you felt things are just moving forward, if it's something that you can keep up or if it's like, you know, a lot of people get an idea that we're going to make so many changes that they won't even be able to eat food, it sounds like in some cases when we're done. But I mean, you get out to where you have lots of options. It's pretty normal stuff and not too hard to manage. Would you agree with that?
Yeah, I definitely agree. I felt that same way in the beginning too, just being like, oh my goodness, what do I eat? You know, and it took a little bit to figure things out, but I feel like within a week, I was like, okay, I can do this, and just jumped in with both feet. And I feel like as we were able to add more foods back in and get things settled down, like, I don't feel like there's really any restrictions that I have. I can enjoy all the things I want to. So it's definitely sustainable.
Awesome. All right. Well, thank you for sharing your journey. And I know your story will inspire a lot of people. And your progress really shows what's possible when we support the body at a cellular level and then stabilize your thyroid and your blood sugar function. So thank you for being here and sharing that. I'm proud of the work that you've done.